CT plays an important role in diagnosing a disease. Imagine a doctor cutting open your body to just see how your body parts are working. This was what the situation few decades ago. Now, thanks to the advancement of medical technology, there is no need for a patient to go under the knife for a diagnosis of a disease. CT is a simple, non-invasive diagnostic method which is far superior than a normal X-ray, which we all know. A normal X-ray gets the internal image of a section of the body only from one angle. The CT, on the other hand, gets multiple images from various angles. Its strength lies in giving high-resolution images of bones and soft tissues inside your body to help your doctor identify defects easily and accurately. The CT captures the cross-sectional images of the body which are put together to form a full picture, much like the loaves of bread. The CT can also give a three-dimensional image. Why CT? You have seen what a CT is, a computerized tomography. But why is it done? What is the necessity? Let us see what exactly are the reasons behind CT. To diagnose muscle and bone disorders, bone tumors and fractures, detect the exact location of a tumor, blood clot or any infection. During surgeries, to guide the surgeons perform various procedures like biopsy and radiation therapy. Detect and monitor diseases such as cancer or heart disease. Detect internal injuries and internal bleeding. Exposure to a radiation in a CT is slightly more than the normal X-ray, but doctors believe that CT benefits far outweigh the risk. Precautions. Pregnant must inform the fact to the doctor so that they may suggest an alternative method like ultrasound or an MRI scan. Rarely, the contrast material causes allergic reactions in some people. The risk is more in case of patients with heart disease, asthma, diabetes, kidney disease, and thyroid disorders. Contrast material. Contrast material is needed for some CT scans to help highlight the areas of your body being scanned. Contrast material block X-rays and appears white on images, which can help emphasize blood vessels, bowel, and other structures. Contrast material can be given in various ways. Oral. If your esophagus or stomach is being scanned, you may need to swallow a drink that contains contrast material. This drink may be unpleasant and in some cases cause diarrhea. Injection. Contrast agents can be injected into an intravenous line to help view your gallbladder, urinary tract, liver, or blood vessels. You may experience a feeling of warmth or a metallic taste in your mouth. Rectal. A barium enema is a type of contrast material that visualizes your intestines. It makes you feel bloated and uncomfortable. To properly visualize some areas, you may need to fast for a period of time beforehand. CT for children. Now let us see how a CT for children is done. If your infant or a toddler has to undergo a CT scan, doctors might give your child a sedative to keep him or her calm and still, as any movement during the scan would cause inaccuracy in the results. How CT is done? Depending on which part is going to be scanned, a patient has to prepare by changing into the hospital gown and removing metal jewelry, which might interfere with image results. CT scanners are large ring-like structures. You lie down on a table that slides into the hole, which is called gantry. Strapping and pillows help you stay in a position. During the CT scan of head, table may be fitted with a special cradle that holds your head still. As X-ray tube rotates around your body, the table slowly moves to the gantry. While the table is moving, you need to hold your breath to avoid blurring the images. You may hear clinking and whirring noises. Each rotation gives several images or thin slices of your body.
Doctor asked me to have a CT scan. I fear a lot of these medical tests. Doctor told me that CT scan is also just like an X-ray. I had the test and I am fine now.
After the exam, you can return to your normal routine.